Throughout this presentation, there are some cartoons depicted at the bottom of the slides or to the side. In no way are they there to make fun of someone that has a mental disorder or a problem. They're there to enlighten the student on what the mental disorder is about. So please, I hope that no one's offended in any way. Cause of mental disorders. Some people can have a life crisis happen in their life. A shocking experience for them could be different than a shocking experience for us, but something that happens that gives them enough stress that they fall away from mental health. Environmental stress can also play a role in that. That has to do with our surroundings. They can be physical or the mental demands associated with our surroundings. We can add to our stress by the places we hang out or the things we do. For teenagers, young kids, usually their family is the most influential environmental factor because, do you live in a loving, nurturing, caring environment, or are there other things going on that can provide a lot of stress there? Heredity has a role to play. We know that some mental illnesses or diseases are hereditary. Some people, like for example, have chemical imbalances that can cause schizophrenia, and they can go along until they're in their 30s, and all of a sudden they'll develop a form of schizophrenia, and then have children and them have the same problem. So this can be one of the major causes. We also have organic mental disorders, and this is because of some physical or chemical trauma that's happened to the brain. Either a blow or let's say they've ingested something of this kind, any kind of change in the brain's chemistry that way. Here are some more causes of mental disorders. You can pause this and look at any of these at any time. There are some major types of mental disorders that we're going to examine. We'll break each one of these down. The first one, anxiety disorder. This is where a person has real or imagined fears, and they happen so often that they prevent the person from actually having a normal, healthy life. Everyone has phobias or fears, but is the fear so bad that you cannot perform effectively in society or have relationships with other people? Obsessive compulsive behavior. This can be categorized by excessive gambling. This is where you could you have to have everything perfect in the room. If someone moves one thing, then your whole life is distraught. A behavior you have to do. General anxiety disorders are there where someone feels anxious, upset all the time. They're constantly in a state of panic or worry. Dissociative disorders. This is where you separate yourself from your memories or your real personality. If you look at this, amnesia, someone no longer can remember an event or a period of time, or worse, they're who they are. Amnesia can be caused by a physical trauma, or amnesia can be caused by someone has some experience happen in their life that their body or brain has just decided it's going to shut off and not allow them to remember it because of the pain or hurt associated with it. Multiple personality disorders. Obviously, there's two or more personalities living within the person. Sometimes they'll have different names. They'll talk differently. They'll have complete different actions. A lot of times, the other person exists to solve a problem of some nature. How they have trouble handling certain issues. Usually, something bad's happened in the person's life for them to have this happen. Mood disorders. Now remember, everyone has moods, but if your moods are so extreme, again, they interfere with your daily living, then we tend to diagnose them as a problem. Depression is one of those. If it interferes with how you can handle other people or handle things with your intense sadness, then we have to get some treatment. Mania, where you have all these ideals coming at you and there's so many of them coming at you, you can't focus on anything. And you're constantly in a state of flux. Bipolar or manic depression disorder, this is extreme moods. This is either you're really ecstatic and very happy, or you're extremely depressed and upset. Personality disorders are where you have a personality that is so extreme that you'd have trouble existing in society in one way or another, either with other people or at work, something of this nature. Here's some examples. An avoidant person, these people try to avoid social contact in any way, shape, or form. If they are successful in society, usually they'll work out of their own home on the internet or something of that nature and avoid contact as much as possible. Antisocial, these people have little concern at all for anyone else's rights. They'll fight with you at a drop of a hat. They'll be irresponsible. They don't care as long as they're taken care of by you or something else. They are usually considered to be have problems with excessive drinking or using drugs. Dependent personality, these people are very insecure. They're probably never going to move out of their parents' home. They're going to lean on them for advice. They don't believe they can make any decision for themselves appropriately for the most part. Histrionic person, they have a emotional outburst to draw attention to themselves. They have got to have your attention all the time, and they'll do anything to gain it. Narcissists, these people are vain and boastful. They believe in themselves. They're conceited. They think more of themselves, way more than other people. And if you want to know if they're very good at something, just ask them. Of course, they'll tell you. They'll walk over you in the line. They don't care. Passive aggressive, this person switches back and forth from either being very shy about an issue or very out front and taking charge. So, it's either frightened or forceful. Schizoid, these people really should go be put in an institution. If someone with a schizoid personality, they really have really disturbing thoughts that normal people don't have. They also do not like people. They prefer social isolation, and they're not having fun in life. Life is very negative for them. This is someone who would look at you and see you and think about your skin, how great it would be just to make a dress out of your skin. And that's how they would see you and focus on you. That's just an example. Psychotic disorders. There are two of the most common ones are hallucinations. This is where you actually believe in something that you're hearing or seeing and it's not real, or delusions. This is where you have beliefs about yourself or about other things that are just not true. So either you're seeing things or hearing things, or you have beliefs about yourself. There's also schizophrenia, and with someone who's schizophrenia, they really have something wrong with their logical thought process. Everything seems to be okay, and somewhere along the line they make a big right turn, and they're not in touch with reality. They might believe they're a knight or something of this nature. They're just, something's wrong. Somatoform disorder, this is where you have a physical illness which is not associated with your physical being. It's really caused from some emotional problem. You remember Ricky Bobby. Ricky Bobby believed he was on fire, and he took all of his clothes and ran around the track, and actually in reality he was not on fire. He just had a crash. Two types of disorders are the hypochondriac, and that's where they constantly have anxiety about illness. This person will have a large medicine cabinet with everything in it to help them. Then we have conversion disorders. These are people that believe, again, like Ricky Bobby, that something's wrong when there's nothing really wrong. They're not paralyzed and stick themselves with a fork. If somebody really had a conversion disorder, they'd stab themselves with a fork and they really wouldn't feel it, even though there's nothing wrong. Adjustment disorders. This is where they have to make an adjustment based on something that's happened in their life, some stressful situation. We see a soldier here at the right, like they've been through combat, they come back, and there's an adjustment period. Any soldier can tell you that's been in combat, they act a little different. They have to survive, to be successful. You're very aggressive, you're very, you're borderline paranoid, and very aggressive, and all that's got to go away. And if you've seen things like blood and all that, that can affect you and take away some of your feelings and emotions that you normally have and make you more cold in nature. Sometimes these can be temporary, sometimes they're very long-term, but almost always a person will need some kind of counseling to help them through this. A fictitious disorder is where someone actually creates something wrong with them and so they can become a patient. They want a doctor to be able to come see them. It's like they have something about them that just wants them to constantly be visiting someone with medical help, whether it be a psychiatrist, psychologist, a physician. They are going to constantly visit them and constantly be in the doctor's office, and they're going to wonder over a period of time what's wrong with them. They're going to realize they have something wrong with them because there's nothing physically wrong with them. It's all completely driven by their emotions and their emotional needs of seeing a doctor. Tic disorders. These people can't control these. They have sounds they make or movements they make, and there's nothing they can do about it. Tourette's disorder is an example of that. And I know we see a lot of movies where they cuss and do all this, but for the most part, someone with Tourette's, very rarely do they cuss. Most of the time, they'll just make grunts or noises, or they'll make movements that they can't control. So the movies try to always portray them as cussing, but that's not the norm. Impulse control and addiction disorders. This is where you just can't resist your urges. You're going to perform whatever it is, whether it's harmful or bad for yourself. You're going to do it because you are addicted and can't help yourself. Pyromaniac is an example of one. Pyromania, where you start fires and they're going to start fires no matter what. Kleptomaniac steals things they can't seem to control themselves from stealing things, and we have all sorts of alcohol and drug addiction so out there in the world where they're going to continue doing it even though it's destroying them or harming others around them. Sexual or gender disorders. This is people that actually desire or believe that they should be another sex. Even though they're truly a male, they believe in their heart of hearts they were born to be a female, or vice versa. They don't relate to the other sex. They only relate, they can only relate to the opposite sex. And a lot of times they will have some type of transgender surgery to change themselves there. Eating disorders, eating disorder, the person believes really down deep that there's something really wrong with them. They're really heavy or fat, and they can't seem to portray themselves any other way. Even as they lose all this weight and become skin and bone, there's a problem. So no matter what with this disorder, like the other ones, you're going to need to seek some professional help. Anorexia nervosa is just a diet gone wild. You're going to starve yourself into thinness. And bulimia is where you're going to do something. You can eat uncontrollably here and there, but you're going to do something to purge it, to get rid of it. You're going to use vomiting, laxatives, diuretics are used to lose all these things. So yeah, you would either have a tendency to throw up a lot or you'd go to the restroom a lot.